Now, as we increase our COVID-19 testing, we need to increase our contact tracing, which means we need to increase our contact tracing staff. The state job posting is currently on wisc.jobs. We are very excited about our initial response to this posting. Over 1,000 applicants applied in the first few days. The number of contact tracers we need will depend on the projected number of cases we will need to interview. Our goal is to interview every person who tests positive for COVID-19 within 24 hours and follow up with every one of their contacts within another 24 hours to provide them with guidance on isolation and potential testing. Testing, tracing, and tracking the spread of COVID-19 are our way out of this pandemic. And we thank all of you who have stepped up to apply for these positions and help your fellow Wisconsinites. But tracking is not enough to beat this virus. We also need to make sure that our healthcare system is well equipped to care for patients and that our fellow Wisconsinites have access to that care. When we talk about that care, we often talk about making sure our frontline workers have enough personal protective equipment. But there's so much more to patient care than simply equipment. And when we talk about access, we tend to talk about access to testing. But if that testing turns out to be positive, that means people will also need access to patient care. That is why Governor Evers and Secretary-Designee Palm have issued Emergency Order 35, suspending certain administrative rules to make it possible for healthcare providers to really dedicate as much time and resources for patient care. The order allows for more flexibility when it comes to using telehealth to support Wisconsinites who need to access resources for mental health and substance use disorder treatment. Most importantly, for members of Medicaid, this emergency order ensures that no one will lose eligibility for coverage during COVID-19. This change will make it possible to receive federal funding under the Families First Coronavirus Response Act, and this increased funding will support our increased Medicaid enrollment and our increased usage due to the pandemic.